to lower this. I want to definitely thank the organizers. This has been a really interesting day, and I'm sure y'all are as tired as I am. I have been tasked with talking about exposure information, and Carolyn did set me up quite well here. And actually, Francesca noted that she felt like she was talking about small data, in which case I'm talking about teeny tiny and very sparse data. And I think actually one of the issues with exposure data, and I've heard this throughout the day, just listening to different people refer to it and allude to exposure information and environmental components of disease, that there's that it means a lot of things to a lot of people, and that's actually one of the issues. So I'm just going to set up a little bit. So what is it? What is the science that we're trying to enable with exposure information? And so this is a definition, or this is a comment on what exposure science is from the International Society of Exposure Science in some of their materials. And exposure science is considered by the exposure community to be really the bridge between sources of chemical, physical, biological agents and human health. And so the breadth of information that encompasses is in some ways unlimited. But it's crucial information for estimating risks to health and then identifying ways to prevent and reduce those risks. In terms of, what is this science and what are these things, what are the outcomes that you're trying to enable? There's, from an EPA perspective, there's certainly a need for exposure information to do risk assessment. There's a range of approaches. This is widely used in the environmental epidemiology field, in the risk assessment field. Exposure information is obtained using questionnaire-based metrics. Surrogates for exposure metrics include ambient measures, some of the air pollution types of measurements that were discussed. There's more direct or point-of-contact measures that are often employed, and those are rather intensive to collect. But there's new technologies that are now doing that at a more real-time, rapid rate. And so as those technologies develop, we might imagine some larger data streams coming about. Biomonitoring, NHANES is sort of our gold standard in that area right now. But also there, we're talking about the potential for some more global approaches on that side that may bring us additional data streams that would be not so tiny and not so sparse. And then we use a lot of modeled estimates. And interestingly, those modeled estimates are often referred to themselves as exposure data. Okay, so also what other kinds of science do we enable with exposure information and translation, both in for public health policy, for medicine and personal risk management requires exposure and environmental factor information. Some of the systems biology that we're trying to do now, what are those perturbations that we're interested in that are leading to particular outcomes that's at different levels of biological organization can also be considered exposure information. And more as people are moving towards, there was a couple NAS workshops that this committee has in the last couple years organized and sponsored, focus on measuring and characterizing the exposome, and that is the kinds of information that we're talking about enabling here. That's the kind of science we're talking about enabling. Okay, so exposure data sources. George covered some of these things, and so some people consider some things exposure, other people don't. But I'm just going to put them all out here because they're the kinds of things that people are using and are integrating and are calling exposure data, believe it or not. So some of this is sort of information on sources and stressors, and some of it is things that are measured, some of it's things that are reported for regulatory purposes. ranging from environmental releases to things that are actually in consumer products that you can find in the ingredients or you can find in MSDS sheets. Transport and fate. Now you're talking about information on use of particular products and chemicals, transformation in the environment, environmental concentrations. Here's where you have some actual measurements of, I'm focusing a lot on chemicals because that's kind of where I am right now. But the concentrations that are measured in environmental media or in biological media. And then this this figure here calls exposure these measurements that are more of these personal level monitoring. And then some other factors that are associated with behavior and activities and things that would bring a person or a biological agent in contact with chemical or other stressor. Okay, so what is some of this, what does our current exposure data landscape look like? I didn't do it in terabytes. I'm not sure if we know that, but it, depending on what you're interested in, this is the network of the exposure taxonomy that's used in ACTR, which was Matt mentioned earlier as a data resource that has been developed in the Environmental Protection Agency and the Office of Research and Development. And so there's just lays out all the different kinds of data and information that I just talked about and how it's connected in that particular resource or how it's entered in that resource and annotated there. We have then, based on having pulled in a lot of that different kinds of chemically linked exposure information, done a survey of, so what do we have in there and how much information do we really have to tell us something about exposure. There's a lot of reported data on production volume, so 10,000 compounds required reporting. Once you get down to things that are actually measured, so to me that's real data, in my mind, you get down to very small numbers. This is, if you notice the scale now, you're only in the, very low hundreds for what we're measuring in numbers of chemicals, not numbers of samples or data points, but numbers of chemicals measured in environmental or biological media. You're down to very small numbers. So the universe is, we pretty much measure what we're looking for, and that's about it. So what are some of the resources that, so the gist of it is that there's data out there. Sometimes there's a lot of data if you're thinking about some of the air pollution kinds of monitoring data that was discussed. Sometimes there's high quality data like NHANES, rich data but for a very small number of compounds. And then there's a lot of other smaller observational studies or epidemiology studies where exposure is measured in different ways. Those things are out there. They're reported in the literature, but they're not necessarily data that are available and accessible. So what we have started to do within EPA and with people like Carolyn is to start to say, well, how can we just start making things available, even given restrictions imposed by IRB requirements and human study issues. So the first thing is this ACTR aggregated computational toxicology resource. To me and to certainly others in the exposure science community, it's really critical that even if the information we have is smaller than some of these other data, they need to be accessible, and they need to be accessible in a way that the others in the environmental health and the broader health community can access these. Because I think it's kind of a chicken and an egg thing. How do we move toward more global technologies for measuring environmental factors? We can either say, well, we're not going to put data out because we don't have it, or we can put the data out and let people see how it could help them if they did have it. And so that's kind of been my mode of operation, is that the more we put out there and the more we make it accessible and make it pop up when somebody starts looking to do hypothesis development or to look for associations and connections, the better the case is for how this information could be valuable if we broadened our technology and our monitoring and measurement of these different media and chemicals. So anyway, ACTR has that kind of full range of exposure information, very broadly defined and very specifically tied to chemicals. And most recently, there has been an effort to also tie to products. So if a chemical is in a product, that information has now been brought in through significant mining of Walmart MSDS sheets. And so that's a really neat addition, and that starts pulling in some bigger data and thinking creatively about how to mine stuff that's out there and accessible. Okay, so the other thing that we've done is a component of ACTR added this exposure, we're calling it ExpoCast DB. So this is an exposure database that has focused very specifically on consolidating observational human exposure data, so that these things, the measurements that are made in the EPA has a handful of very good observational exposure studies and has also funded quite a few in collaboration with NIEHS, and there are, once again, other environmental epidemiology studies out there that would be incredibly valuable to mine. And the point is to consolidate these data, provide an interface within ACTR to access these data, but in a way that you can link them with the toxicity data and other environmental fate data and chemical manufacturing information, and then to provide some basic user functions, which on some level is secondary. So this is the data model that we started with. And really the only things that are currently implemented in the prototype and for these handful of EPA studies are the measurements, the actual measurements of chemicals in environmental media and exposure media and biological media. And there's certainly not unfounded criticism that what's the point of that if you're not tying it to the subjects and the locations and the other factors in the studies. And I would just argue that, once again, it's a matter of making things available and informing hypothesis development and putting things in, so you can, not everybody has to dump their data into this database, but if we as a community start to make things available and make parts of what we're doing available, I think it just will help make the case for why this information really can be very valuable. So right now there's 4 initial studies from EPA's National Exposure Research Laboratory that have been put into this ExpoCast DB. The full raw data sets are available for download, but there's also some browsing capability and descriptive statistics capabilities. And these are, once again, all tied to chemicals. So we don't include in this particular database some of the exposure factor information, which has more to do with behaviors and consumption rates and inhalation rates, things like that. Okay, so things that this database can currently be used for include investigating occurrence and co-occurrence of chemicals in these handful of studies, comparing across studies. This is making this tiny little tool in and of itself makes it easier to just make that one leap. And then to do things like delve down and download individual data should you become more interested for modeling purposes or for whatever kinds of assessments you want to do. So this is just, one little grab of information on one of the studies in the database. This is the children's persistent pollutant study that was done by EPA's National Exposure Laboratory and is considered to be a very rich observational exposure study. And so all this is here's the detection frequencies in different media for the 50 or so chemicals and the couple dozen of exposure media that are characterized. And so you can just start to see there's this one, and then there's ones where you go across multiple studies. And in fact, this has North Carolina and Ohio. And it's just a way to sort of more globally now start to look at the limited data that we do have. Okay, so that brings me to where Carolyn left off, and that is that there is some of additional information buried in the literature, a lot of it, some of it buried in people's laboratories. And so we're hoping that people will just want to come forward with this kind of information. And as a community, and once again, to me, one of the most important things about any of the efforts that we've done over the last few years is about, first of all, making things accessible, and they have been accessible to in some form. At EPA, these data are public. Many of the data are public, including more of the metadata and associated information on QA/QC of the laboratory samples and things. So it's not that that stuff isn't accessible, it's just incredibly difficult to get at and incredibly difficult to use. So if what you're trying to do is link across disciplines and link exposure information to tox information to genomic information, it's been really, really cumbersome and difficult. So looking at the other fields in health sciences as a model, and looking at this neat resource that Carolyn had been working on for quite a few years with the comparative toxicogenomic database, we noticed that, well, one thing that's not there is, so you can infer that a chemical may be associated with the disease based on the disease association with the gene and the chemical with the gene, but where's the information that tells you where that chemical really is prevalent in places where people are or ecosystems are? So that was really the driving force for, isn't this a good place to begin demonstrating this link and curating this information? And so the ontology, we began this effort to, well, Carolyn was really the spearhead of this effort, but to begin to bridge this gap between exposure science and the other environmental health disciplines. And the initial focus of the ontology and certainly of the curation, what did I touch? I don't know what I did. Did I touch something? No, I don't do music lists. Unless,
well, it looks like it's back.
Okay, yeah, I
whatever
pushed
you did,
else.
it's gone.
Okay. No, I don't, unless my son did something. Okay, so we focused initially on human exposure to chemicals. So that was the humans and chemicals. And then ultimately, there's no reason that this couldn't be extended to domains that encompass the full range of receptors and stressors. And so just to throw out, I'm completely losing track of time, definitions of central concepts that came out of this. And these are not new to the exposure field, and the definitions were, one of the real key things, and I get the I get the half-hour conversations about very small points. And Carolyn and I am sure when we heard that half-hour thing, we're like, "That's it." That was way more than a half hour. It can go on for quite a bit, and you have to sit and listen, and then you just have to put something on there and move on. And so that's where we're at. We did something that made sense, and we're moving on. And then we expanded beyond those central concepts to address some of the other kinds of data that you would need to annotate. And what was really fascinating about this, and to me is somewhat, and I don't know if this is unique to exposure information, I suspect not, but somebody did refer to the fact that we measure surrogates. And we, even if the data that we collect is one thing, the physical thing that happens in an exposure event based on time and location isn't necessarily what we're measuring. So that was a really hard thing to get past in our discussions with the community was, okay, we know what really happens, we know what we model, what is the data and what is the information, and how do we put those associations and relationships in a way that are computable and useful for moving forward with just making this information available and linkable. And so this is where we came out as our first pass. And we do through the comparative toxicogenomic database now, and Carolyn's doing curation for proof of concept and really prototype here. This is really affording the opportunity to link some of the critical exposure information and data to the wider health information. And so this is just a reference to that curation. And so I'm going to very quickly give you an example of how having the information available in Actor, in ExpoCastDB, and as I recall, one of the questions was an example of, so what would you do if you had better links and better information, and where has that kept kind of hung you up? So in the National Center for Computational Toxicology and in our Chemical Safety for Sustainability Research Program, one of the key things we're trying to do is do some kind of higher throughput exposure assessment that can be linked to the kinds of hazard predictions that are coming out of ToxCast. And so I guess what I would say is that there's methods for high throughput in vitro methods and quite a bit of data that are really beginning to bear fruit on how we do hazard evaluation for large sets of chemicals. And there are also methods, Rusty Thomas at the Hamner has led development of methods for converting the in vitro results to daily doses. And these are crude conversions. They're, all of this is high level, kind of first pass. What can we say to evaluate safety of these chemicals? But what we don't have is a similar capacity for exposure, or what we haven't had. And so here what you're looking at are for, I believe this is really ToxCast phase 1, so it's mostly pesticide active compounds, and the dots, the top dots and error bars, those are the calls from ToxCast on, those are the AC50s from ToxCast, and then the little dots and bars in yellow and green, those are exposure estimates from pesticide registration documents, and so those are considered to be very data rich and some of our best exposure information that we have, because the pesticide, the way that pesticides are regulated, they're required to submit certain kinds of information. So when you go to phase 2 of ToxCast, where now you've gone beyond that 300 chemicals to 1,000 chemicals, the number of chemicals for which we can say anything about exposure drops to 10%. And so we have now a framework for how we would make some estimates of high throughput exposure, and it requires really pulling every bit of information we have and doing some modeling and then calibrating to NHANES information. And so I don't want to go into the details of that, but I'd be happy to if someone's interested. The gist of it is that for the chemicals we were trying to run this analysis on, which is about 2,000, the models that we're using, the models that can do this quickly and with almost no data, so they're really doing a lot of chemical property estimation and then fate and transport, equilibrium-based modeling. They can handle about 1,600 of those 2,000 chemicals. And already, mind you, these chemicals are restricted by what the high throughput tox testing can do. And then there's production and release data, like I showed you, on quite a few compounds, but only a subset of the ones that we were interested in evaluating here. And then if you look in NHANES, there's about 80 of the compounds. Okay, so we're really dropping down in the information that we have to do this kind of analysis. So what's the end game is that now we have these exposure estimates, and they span about order. The bars include the uncertainty associated with those estimates, and they're, it's like about 8 orders of magnitude uncertainty. So, which we're very pleased about, really, because they're estimates. So that's like not empty space, they're just big lines. So we couldn't even do this without having the data in a way that we could access it and use it in a rapid, efficient manner. And now we've sort of really, this was John Wamba and Woody Setzer really led this analysis, and now they've kind of set the stage in a very quantitative way to say, you know what, you want it better, bring us data. Okay, and I just want to really thank Richard Judson, Peter, John Wamba, Woody Setzer. I neglected Sumit Gainwell was a postdoc who really led development of the ExpoCast-DB in its initial stages, and of course Carolyn and the team that worked on the exposure ontology. And I'll take questions tomorrow, right?